Guideline number 26. Redesigning seating arrangements to ensure at least 6 feet of separation from seating to seating, or utilizing physical barriers to separate groups of seating within 6 feet. Currently, there are no recommendations available from the U.S. Food and Drug Administration or Center for Disease Control and Prevention on the size or height of a physical barrier. Each restaurant and bar must use its own judgment when determining dimensions of physical barriers that will afford patrons adequate protection from the virus that causes COVID-19. Physical barriers should be as large as practicable and should be impermeable to respiratory droplets and aerosols. Guideline number 27. Where practical, consider a reservations-only business model or call-ahead seating. Guideline number 28. Post signage on entrances that no one with symptoms of COVID-19 is permitted in the facility. Signage should be designed in such a manner as to be easily seen and read by any patrons approaching the restaurant. Guideline number 29. Where practicable, physical barriers such as partitions or plexiglass at registers should be used. Guideline number 30. Use technological solutions where possible to reduce person-to-person interaction. Mobile ordering, mobile access to menus to plan, text on arrival for seating, and contactless payment options. If pen pads are used, they should be sanitized between patrons. Guideline number 31. Provide hand sanitizer for use by patrons, including contactless hand sanitizing stations when available. Hand sanitizer must be provided. However, it is also recommended to use the contactless hand sanitizing stations if possible. Hand sanitizer wipes are an acceptable form of sanitizer to provide for both patrons and workers. See the definition of hand sanitizer above under Worker Health and Safety Measures. If hand sanitizer is not available, the restaurant will not be allowed to open its dining room. Guideline number 32. Do not allow patrons to congregate on restaurant premises or curtilage thereof. Design a process to ensure patron separation while waiting to be seated that can include floor markings, outdoor distancing, or waiting in cars. Guideline number 33. If possible, use an exit from the facility separate from the entrance. Guideline number 34. Mark ingress, egress to and from restaurants to establish paths that mitigate proximity for patrons and workers. Guideline number 35. All restaurant or dining room playgrounds shall be closed. It is further that none of the provisions of this section of this order shall apply to the operation of the dine-in services in hospitals, healthcare facilities, nursing homes, or other long-term care facilities. But such facilities should implement measures to prevent the spread of COVID-19 if possible. The order directs these exempted facilities to implement the order's operating guidelines to the extent possible. It is further that the routine inspection timelines under Georgia Administrative Rule 511-6-1-.102 may be extended by the Georgia Department of Public Health by 120 days for any permit holder for any such food service establishment maintaining an A food safety grade, for any such food service establishment which was scheduled to have a routine inspection at any time between March 14, 2020 and September 10, 2020. This is to allow the regulatory agency flexibility in prioritizing high-risk establishments. However, any new restaurant that opened within 60 days prior to or after March 14, 2020 is still required to have its initial routine inspection, even if its opening score was an A. Any food service establishment with a history of fluctuating scores that received a score of an A on the previous inspection should be included on the list of high-risk prioritization. All restaurants or dining room playgrounds shall be cleaned and sanitized regularly if in use. If playgrounds are located indoors, it is highly recommended to ensure adequate ventilation in those areas to reduce the risk of aerosolized transmission of COVID-19.